Hello, I'm Danielle. I work as a lecturer here at UTS and I'm currently coordinating the second year mental health subject, and I also work as a clinical nurse consultant in the Sydney Local Health District. I wanted to let you know a little bit about what an actual interview might look like when you go out into practice. And typically on an interview panel there would be a nurse manager, there would be someone from HR, and there would also be an external rep from a different ward or a different health service as well. I think before you go to your interview, it's always a very good idea to be as prepared as possible and then get there on time and with all of the information that you need. It's always better to overdress rather than to underdress. I think it's very helpful to practice interview techniques with your peers, perhaps your family members or other colleagues, and get them to give you feedback. And generally the feedback and what you do with the feedback is much more helpful than trying to rote learn answers for the interview. It's always a very good idea to research the specialty area that you're going to be interviewed in and make sure your answers relate to the specialty or show how you can make your answer relate. Another important point is if you say you're very good at communication or you're an expert with communication, be an expert, because the interview process is a communication form. A few of the things that I would look for in an interview are consolidation of your knowledge and skills and evidence in the answer that you give that you know what you should be doing. If possible, give evidence of the process of reflection that you use if you reflect on your practice and how you might use that to improve. And also examples of how you translate your knowledge and skills into practice and provide good examples from relevant clinical practice. As a registered nurse, you'll be working in a team environment. Typically, you may be caring for the following patients: a patient who has IV antibiotics due at 0800 and it is now 0830, another patient who is complaining of feeling very weak and lightheaded. The third patient with a history of high blood pressure is having a nosebleed. Can you tell the panel how you would prioritise the care for these patients and why?
As a registered nurse working as part of the team, I would ask for assistance from another member of the team to assess the patient with the nosebleed as I attended to the patient who was complaining of feeling very weak and lightheaded. I would choose to address this patient first because they may be experiencing a pre-syncope state, and early intervention would be required to prevent them from fainting. As I repositioned the lightheaded patient into a supine position, obtained a full set of vital signs and did an A to G assessment, I would inform the team members available to help that the patient with the nosebleed has a history of high blood pressure and may be having an episode of hypertension, and would request them to obtain a full set of vital signs and complete an A to G assessment just to ascertain if there are any other signs of deterioration. If there was another spare person not assisting with the currently unstable patients, I would ask them to commence the IV antibiotics, as I'm aware that maintaining peak dosages relies heavily on timing, but I wouldn't move on to that patient until my other patients were stabilised.
Look, the antibiotics are already 30 minutes late, so I reckon you should definitely get on top of that. So I'd go and get that started. And then, well, the guy with the nosebleed, he's bleeding, so you need to clean that up and make sure that, you know, sit him down and everything. And then probably the person who's feeling a bit, what was it? Was he lightheaded? Yeah, lightheaded. He probably should just have a rest. He might just be exhausted. Where'd you get this plant, by the way? It's really, really nice. Is it Bunnings?
New South Wales Health strive to reflect core values in the workplace. What is your understanding of what the O represents, and please give some examples.
The Code of Conduct outlines the ethical and professional frameworks for which those who work as part of New South Wales Health are expected to work within. The core values of collaboration, openness, respect and empowerment help facilitate a positive workplace culture and are one of the main reasons I wish to secure employment within such a community. I think the O for openness reflects how New South Wales Health wants to foster transparency between health facilities and the community. And an example of this is through feedback and survey by consumers and employees alike. This ensures confidence in local health services not only by those who use the service, but by those who deliver the service. This encouragement of open and clear communication makes all stakeholders feel valued and respected. And as a member of the New South Wales Health, I would strive to include my own openness in my practice, especially with my colleagues. As a nursing student, I witnessed a registered nurse unintentionally contaminate a sterile field. The registered nurse was unaware that they'd made a mistake and was continuing on with their preparation of the procedure. I openly fed back to the registered nurse that I thought their sleeve might have accidentally brushed on the sterile field. The nurse lifted their arm to check, noticed their sleeve had become dislodged and had most likely contaminated the sterile field. I offered to fetch the necessary equipment to begin the procedure again while the nurse disposed of the contaminated one. The nurse was grateful for my help and we worked together to minimise the time delay and ensure the best outcome for the patient. It was a good learning experience for me on how open communication, if done collegially, can prevent escalation of issues and help foster good relationships.
Core values. We talked about that. I remember that. I remember now. The O stands for organization, because it's organizational, because it's really important when you're a nurse to be organized. Like if you're not organized before operation, you might forget something or you might not do something quite right. It's really important. Also, when you have like a lot of charts, it's important to like organize them so that you can find them again. Yeah, organization, very important as a nurse. Yes, core values.
Now I'm going to give you 4 examples and I would like you to prioritise the care of the 4 patients. The first has a medication due. The second has a cannula that has tissued. The third is becoming verbally aggressive. And the fourth has SATs of 88%.
The patient with oxygen saturations of 88% is the immediate concern. They will require oxygen therapy via Hudson mask at 6 litres. This patient is clinically deteriorating and I would not leave them until there's been a management plan implemented. I will call for help from other members of my team to assess the verbally aggressive patient, as I'm aware that a change in mood can be a sign of a decrease in mental status or hypoxia. This patient needs to be assessed for signs of deterioration too. This patient should also really not be left alone until a management plan has been implemented. The patient with the tissue cannula is at risk of further damage unless the IV is ceased immediately and also removed. It would depend on the type of infusion and the patient's condition on how high up my priority list would be to get the cannula replaced. However, management of the damage already done would be paramount. The patient with medications due cannot be forgotten, and if able, I would ask a member of the team to distribute the medications while I attended to the other patients. If the medications were time critical, like insulin, I would be more insistent in gaining help.
All right, so I'd probably, the person with the SATs of 88%, he might just have some trouble breathing. So if he's laying down in the bed, I'll probably just go and sit him up so that he can breathe a bit easier. And then of course, medications too, it's really important to give a medication on time. So I'd go and make sure that the medication was given to the patient. What else was there? Oh yeah, the verbally aggressive man. He's being really, or the patient, he's being really disruptive to all the other patients. So I'll probably go and see if I can calm him down. And if he's just being, I don't know, ridiculous and it's not calming down, I'd call security to make sure that he's stopped. And then the cannula, it's important to take it out, stop it and then just take it out because it's not doing any good at the moment. And then go back to the SATS patient and make sure that his oxygen levels are better, I guess. Yeah. That would be my solution.